I'm Dr. Ali. Welcome back. For those of you who are joining us for the first time, I'm a functional physician dedicated to providing education and guidance to our patients and their families, as well as our community on how to achieve optimal health and wellness. Everyone has the ability to achieve optimal health, and that by making simple, sustainable changes to your lifestyle, you can prevent and even reverse chronic diseases. Today, we will be talking about one of the most important root causes of chronic disease, and that is leaky gut. So let's start off by asking the question, what is leaky gut? Followed by discussing the common myths and truths about leaky gut. So what is leaky gut? Leaky gut is a condition in which the lining of the small intestine becomes more permeable than normal. What it simply means is that there is breakdown in the lining of the small intestine. And because of the multiple breakdowns in the lining of the small intestine, undigested food, toxins, bacteria, and fungus can actually go from inside the gut into the bloodstream. And this is a situation which can lead to adverse consequences such as inflammation, malnutrition, as well as symptoms such as fatigue, autoimmunity, as well as mental health issues. So the question is that, what are some of the myths about leaky gut? So the first and very important myth about leaky gut is that leaky gut is not scientifically proven. The fact is that the scientific name of leaky gut is intestinal permeability. And there has been a lot of research that has been done in this area, and it has proven that intestinal permeability is a phenomena that is seen in many chronic diseases. Rather, the links between intestinal permeability and chronic disease has been proven in many different areas, be it neurological diseases, autoimmune diseases, be it metabolic diseases. Even cancer has been linked to intestinal permeability. So this is actually a researched phenomena that has been connected with many conditions of the body and is important because it may provide us a way to reverse some of those chronic conditions. The second myth is that leaky gut is caused by problems in the digestive tract. However, that is not true. It is true that there could be problems in the digestive tract that can cause leaky gut, such as food, in particular junk food or processed food, bacteria and fungus in the gut, malabsorption issues can lead to leaky gut. However, it is not always the case because there are a lot of other factors which can also lead to leaky gut, such as chronic stress, hormonal imbalances, medications, infections, as well as environmental toxins such as mold, as well as metallic and non-metallic toxins. So when we are looking at leaky gut, it is important to not only consider the digestive tract as a possible cause of leaky gut, but also look at other organ systems which might be contributing to the problem. The next myth is that leaky gut is a result of food sensitivity. That is not always the case. There could be certain foods which can make leaky gut worse, but leaky gut itself leads to food sensitivity. And that is more likely than the other way around. The reason for that is that when the intestinal lining becomes more permeable or more leaky, or breaks down, then larger food particles and other substances pass through into the bloodstream. This leads to an immune response, leading to the development of antibodies against those undigested food particles, which give rise to food sensitivities. So, the possibility of leaky gut leading to food sensitivity is much higher than leaky gut as a result of food sensitivity. What can happen is that certain foods that are inflammatory in nature can make the intestines more permeable. And then once it becomes more permeable, then the amount of food that gets into the system gets very high. So it could become a vicious circle. And so it can go both ways. But once there is a leak, there is a high probability of developing a lot more food sensitivities as a result of the leakage. The next myth is that leaky gut can be cured by avoiding certain foods. Yes, it is true that leaky gut can be improved by avoiding certain foods, particularly foods that can cause inflammation. We also need to understand that it may not necessarily be the cure because foods and the kinds of food that we eat change the microbiome. And once the microbiome is changed, then we will need to address the microbiome and we will have to fix the microbiome. The other thing to consider is that leaky gut is not always caused by food, which means that there are a lot of other factors which are contributing to leaky gut. And hence, it is important that those factors be addressed in order to help heal leaky gut. So we have to look at the bigger picture when we are looking at treating, addressing, or healing leaky gut. The next myth is that leaky gut is a rare condition. Leaky gut is by no means a rare condition. It is much more common than previously thought. Studies have estimated that up to 20% of the population may experience increased intestinal leakage. And that is one of the reasons that we see a lot of different health conditions. And so it is not a rare condition by any means. Unfortunately, it is often overlooked as well as underdiagnosed. Leaky gut is a result of chronic disease, is a myth. Leaky gut is actually cause of a lot of different chronic conditions, such as irritable bowel syndrome, inflammatory bowel disease, such as Crohn's disease, as well as heart conditions, diabetes, cancer, neurological diseases, autoimmune conditions, so on and so forth. So if you want to address the root cause of your problem, and if you have a chronic disease or you have chronic symptoms such as fatigue or migraines, you need to be able to ask the question if leaky gut is one of the important root causes of the issue that you are facing. Because if you can address that issue, then you can definitely make a huge impact in terms of improving your health condition and the quality of your life. The next myth is that there is no test to diagnose leaky gut. The truth is that there are a lot of different ways leaky gut can be diagnosed. In functional medicine, we can do blood work to identify leaky gut, and there are also some stool tests that are known to help diagnose leaky gut. So it is a condition that can actually be objectively diagnosed through testing. And we do that on a regular basis in our practice. And it is very helpful for the patient to be able to see the extent of leaky gut that they have. One of the very important ways to test for leaky gut is to look for certain types of antibodies and the presence of those antibodies and the quantity of those antibodies helps us determine how severe is the problem. The next myth is that leaky gut is not reversible. The truth is that leaky gut can definitely be reversed. And the way to reverse it is to go through a functional approach. The functional approach is an approach whereby you identify all the root causes, including those in the digestive tract and those outside the digestive tract, and address them. Once you're able to address those root causes, you will be able to prevent the leakage from getting worse. And once you have taken care of those causes, then you go on to the next phase, which is what we call healing of the leaky gut. Because until and unless you remove the causes which are causing the leakages, healing will not be very beneficial because the causes are still present and they will continue to create leaks. So there are two phases. The first one is to be able to identify the factors which cause the leaky gut. And the second is to repair and heal the leaky gut. So it's an actual process whereby we do that in a customized manner in functional medicine. How can you identify leaky gut? Clearly, this is not something that can be identified without testing. However, there are signs and symptoms. As I have said before, if you have a chronic condition, that is either linked to digestive issues or it is a chronic condition such as diabetes, heart disease, autoimmune disease, food sensitivity, especially having a lot of food sensitivity, migraines, frequent infections, all of those, or hormonal imbalances, all of them are actually indicating that the possibility of leaky gut is there. And if that is the case, then you may need to get diagnosed through proper testing. And once we diagnose that, then we can go ahead and treat the condition. And so the way in a functional medicine approach we heal leaky gut is by really looking at the bigger picture. We look at the microbiome, we look at the absorption factors, we look at nutritional deficiencies, we look at hormonal imbalances, we look at infections, we look at toxins, whether it be mold toxin, Lyme as an infection. We look at environmental toxins such as heavy metals. We also look at non-metallic toxins in the environment. And by looking at the complete picture, we are able to tell what are some of the variables that are causing the problem. And once we identify those variables, we go ahead and treat those variables. And once we are able to treat those variables which were actually causing the leakage, then we go ahead and do the process of healing the leaky gut and repairing the leaky gut. And once we're able to achieve that result, we see that the patient's chronic problems have actually significantly reduced and sometimes completely gone. And so that is a functional approach to addressing chronic disease. So here is basically what we do. Here are some of the things that we do. Number one, underlying imbalances are identified. We address the root cause. Usually the interventions that we do are nutritional interventions. However, we also have what we call hormonal interventions that we have to do. We also have non-invasive interventions that we do, such as microcurrent neurofeedback. We also do intravenous nutrients at times to help us in situations where we need to detox or where we find that there has been a significant degree of adrenal fatigue that is there, or we find that there is issue with severe inflammation. And also we use infrared hypothermic therapy at times to help us address some of the root causes. So there are many, many different ways in which we address the root causes. The therapies that we use are natural therapies. We definitely modify the lifestyle. We talk about meal planning, customized meal planning, because everybody is different and everybody needs to have a different meal plan. And so we look at the meal plan for each particular individual. And of course, we talk about physical activity, we talk about mind body interventions. All of those are extremely important when we are trying to address the leaky gut. So there are many, many different tools that we use, whether it be botanicals, Chinese medicine, Ayurveda, peptides, to help us achieve our goals. And the key is to be able to understand, which tools are going to be best for each patient, because the approach has to be customized in order to really get the results that we would like to see. Thank you so much, and we hope to connect again to bring more information to empower you and to empower your families to be able to get a better quality of life and better health. Thank you.